Uber is ready. Huh?
Good evening, sir.
Good evening. Go ahead. What's your question? Diuretics. Okay.
Diuretics mainly except the.
Your audio is little, voice is breaking. Please check your microphone.
Yes, sir. Okay, sir. My topic is classify mode of action and uses of diuretics. Diuretics mainly exert their effect by the inhibition of renal tubular reabsorption of sodium and water. Classification, according to their efficacy, it classified as high ceiling and low ceiling drug. According to the site of action, proximal tubule, carbonic anhydrase inhibitors, and loop of Henle, loop diuretics and osmotic diuretics, and distal tubules and collecting ducts, the thiazide diuretics and potassium sparing diuretics. Anhydrase inhibitors, it is reversible and non-competitive inhibitors of carbonic anhydrase act by inhibiting the reabsorption of sodium in nephron. These proximal tubules contain sodium H plus antipotar, which helps excretion of H plus and exchange with reabsorption of sodium. This secreted H plus combines with HCO3 minus in the lumen of proximal tubule with the help of carbonic anhydrase to form carbonic acid H2CO3 and converted to water and CO2. These classified drugs are acetozolamide, metazolamide, dorzolamide, and brinzolamide. It can be given as oral, IV, or topical drugs. Uses of carbonic anhydrase inhibitors are angle closure glaucoma, alkalization of urine, mountain sickness, and catamenial epilepsy. Adverse effects: acetozolamide is a sulfonamide derivative. It results bone marrow suppression and hypersensitivity reaction. It can cause metabolic acidosis, urinary alkalosis, and hypokalemia. It should not be used with presence of liver disease due to hepatic coma. Loop diuretics action: inhibition of sodium potassium 2-chloride symporter present in the thick ascending limb of loop of Henle. These drugs are torsemide, furosemide, bumetanide, and ethylenic acid. This is faster acting and shorter duration of action. It decreases the positive as well as negative free water clearance. The inhibition of sodium potassium 2-chloride symporter, absorption of sodium in the loop of Henle decreases. Unabsorbed sodium exchanged with potassium and H plus can cause hypokalemia and alkalosis. Uses of loop diuretics. It is a diuretics of choice in the moderate to severe renal failure, and its main use to remove the edema fluid in renal and hepatic and cardiac disease. Furosemide usually is IV due to vasodilatory action and decreased preload. It is responsible for quick relief in the left failure with pulmonary edema. The same action like morphine also. Among this, bumetanide is most potent and less adverse effect than furosemide. Torsemide is the longest half-life. Loop loses calcium, so it can use treatment of hypercalcemia. Adverse effect: it can cause hypokalemia, hypomagnesemia, hyponatremia, and alkalosis. And it is contraindicated in diabetes mellitus due to hyperglycemia and dyslipidemia. It can cause hyperuricemia, so it is contraindicated in gout patients. Osmotic diuretics action major set of action in loop of Henle. Drugs are mannitol, glycerol, and urea. The ideal substrate, it should be exert osmotic effect. It should be pharmacologic inert, and it should not be reabsorbed, and it should be freely filtered at the glomerulus. When mannitol IV administered IV, it increases osmotic pressure in the blood vessel and consequent removal of excess fluid from the cells, and it increases renal blood flow and GFR. It is a treatment of glaucoma and cerebral edema, maintains glomerular filtration rate in impeding renal failure, and prevention of cisplatin-induced nephrotoxicity. Contraindicated in active bleeding, that is hemorrhage, pulmonary edema, and acute renal. Thiazide diuretics, it inhibiting the sodium chloride symporter in early distal tubule. Drugs are chlorothiazide, hydrochlorothiazide, chlorthalidone, and indapamide. Uses: it is a first line antihypertension drugs. It uses mild to moderate heart failure. It is paradoxically decreased urine output in the diabetes insipidus, so nephrogenic diabetes insipidus we can give. It decreases the excretion of calcium in the kidney. So treatment of patients with hypercalciuria and recurrent calcium stone, just opposite to loop diuretics. Among this, chlorthalidone is the longest acting, and trichlorothiazide is the most potent. Adverse effects similar to loop diuretics and contraindicated in erectile dysfunction can become when combined with AC inhibitors and ARBs. Potassium sparing diuretics. To preserve potassium, it acts in the late distal tubules and collecting duct. It acts in the epithelial sodium channel inhibitors. The drugs are amiloride and triamycin. Among these, amiloride we are using more often. Triamycin is less often used because of interstitial nephritis and renal stones. Amiloride is the more potent and longer acting. It decreases magnesium and calcium excretion and urate excretion. It used as a aerosol in the cystic fibrosis and used as lithium-induced diabetes insipidus. Aldosterone antagonist. Antagonist the action of aldosterone and produce similar effects like amiloride. Drugs are spironolactone and eplerenone. Spironolactone increase calcium excretion while amiloride is the decreased calcium excretion. Maximum effect when aldosterone levels are so high, like hepatic cirrhosis, congestive cardiac failure, and nephrotic syndrome. Uses are it weak diuretics and always combined with thiazide or loop diuretics to counteract the potassium loss. This can be used for congestive cardiac failure to decrease mortality in congestive cardiac failure patient, and diuretic of choice in hypertension and cirrhotic edema. Spironolactone can be used for treatment with hirsutism due to anti-androgenic action. Adverse effects, it can cause gynecomastia, impotence, abdominal pain, and peptic ulcer. In main adverse effect is hyperkalemia. It is metabolized by microsomal enzymes, so prone for drug interactions with other drugs. That's also. Thank you.
Very good. This is a very straightforward pharmacology question, often asked in the examination. And, it is better to describe, as she said, right, from the site of action at the proximal convoluted tubule, loop of Henle, distal tubule, like that. There are pictures available which I will show you. And these 5 groups are the main groups. Okay, I will show you a mnemonic